Hello, my name is Christina and I am doing the trach suction. So first I'm going to start with my OE wipes. So I'm going to verify my order. Then I'm going to gather my equipment. Then I'm going to wash my hands. Then I'm going to identify myself. Hello, my name is Christina Valetic and I'm your nurse, student nurse this afternoon. Then I'm going to identify the patient. I'm going to ask the patient their first and last name and their date of birth. Then I'm going to ask for any allergies. Are you allergic to shellfish, any food or medication allergies, and are you allergic to latex? Then I'm going to close the curtain or close the door. Then I'm going to ask the patient if they're in pain on a scale from 0 to 10. 0 being the least, 10 being the most. And they said 0. Then I'm going to position the patient and have them sit in a semi-collar's position up, right? Then I'm going to explain the procedure. Then I'm going to be suctioning their trach because I walked into the patient's room to assess them and I did a pulse ox and their pulse ox is lower, say 92%, and I'm hearing some gurgling. So I'm going to suction their trach to get some of those secretions out. So to start, I'm going to put on my sterile gloves. I'm right-handed, so I'm going to put my right hand one in first. And I'm going to touch underneath here and put on my left one. So I'm completely sterile. I'm going to move this out of the way. And I'm going to move over here. Now I'm going to contaminate one of my hands, which I'm going to contaminate my left, and add my sterile water. And I'm going to go behind here and grab my tubing to attach to this part. I'm going to stick this in the sterile water, close it off for suctioning. I'm going to take off my patient's, where the trach is, the collar. Now, I'm going to close off the suction and I'm going to stick it in about 6 inches down. And I'm going to clear and go in a circular motion as for suction. For 15 seconds and bring it back up. And then I'm going to assess my patient to see if I hear any more sounds. I may have to do it twice. In that case, I would do this again. And then I would stick it back in 6 inches down in a circular motion. 15 seconds, I would bring it back up. And then I would be I would take this and put this in one hand and take off my glove this way. And then I would take off my other glove this way. That way everything is in one hand. And I would dispose of this into the garbage. Then I would assess my patient. I would do another pulse ox and see if I hear any kind of secretions. Then I would do my safety, which would be lower the bed, lock the bed, 2 side rails up, get the patient their call light and any personal items within reach, ask them if they're for any pain and discomfort, and they would say no, and then I would say, okay, I will be back to check on you shortly. Thank you.